Good morning and welcome to Community Conversations. I'm Vicki Green. I think you're going to find today's show pretty interesting. If you've ever been a patient in a hospital or have a loved one in a hospital, I would guess that's the case for most of you listening. Do you ever wonder how decisions within a hospital get made? Cost of services, insurance, who has the latest research and technology, what are the up-and-coming new services? Well, today I'm lucky enough to spend the next half hour with someone that I truly respect from everything that I've read about her. And now we get to hear more from her. In studio today with me is the very busy mom of twin girls and the CEO of Tenet Healthcare in Massachusetts, Carolyn Jackson. Good morning.
Good morning.
Thank you for being here. And I should say that you are the CEO of Tenet Healthcare in Massachusetts, which means you are the CEO of St. Vincent's Hospital, which anyone in the region knows, especially now that it's downtown. It's not hidden up on the hill. You can see it from the highway, and it's coming more and more in other communities. But you also oversee the operations at Metro West Medical Center, which in Natick and Framingham. And for those of you listening, that's Leonard Morrison Natick, which we called it, and Framingham Union and Framingham. So while you are the CEO of St. Vincent's, you also have to oversee those two, and that's a big job. So welcome to Massachusetts.
Thank you very much.
You officially started in your role around Memorial Day, would that be Memorial?
Yes, that's correct.
And you had to relocate your whole family from Philadelphia area?
Yes, my husband and my kids and our dog all moved up about a month ago, so we're settling in.
Oh, just a month ago?
Yes.
Okay, and so you tried to pick a place in between Framingham and here?
Yes,
okay.
We wanted to find a home that was roughly centrally located smack in the middle of the triangle between Worcester, Framingham, and Natick.
Okay. Did you know anything about St. Vincent's? I mean, you've been with Tenet in the past at other hospitals around the country. Did you know anything about Worcester?
I actually did. I had a couple of touch points with St. Vincent and Worcester when I was in Tenet's leadership development program in 2002 and looking for a permanent place. I actually interviewed at St. Vincent as well as the Metro West Hospital. So I had been on all three campuses previously, but it was a long time ago.
Yeah.
And then when St. Vincent and Metro West came back to Tenet about 6 or 7 years ago, I was in their region. So I got to know the CEOs fairly well in the hospital. So I had a pretty good familiarity with the hospitals prior to starting.
Okay. So you've been in hospital administration for about 17 years, and we should say that before coming to Central Mass in May, well, technically moving a month ago, you were COO at the Hospital of the University of Pennsylvania, which is Penn Medicine, which is an academic medical center similar to UMass Memorial. But before that, you were working at Tenet at St. Christopher's Hospital for Children in Philadelphia. And before that, you were CEO at Tenet-owned hospital in Texas. So I recognize you've only been in a new role for like 2 months, but as you talk to clinicians and all of your constituents at the three hospitals, what have you been hearing? And who have you been talking to kind of figure out the lay of the land and put your plan together?
So I've set up meetings with key physicians at both hospitals and have also spent a lot of time talking to staff, walking around the hospital, rounding, meeting people, seeing what things look like, seeing the condition of the hospital, places where we may need to spruce up, places that look really great, seeing where there are long lines, where there are short lines, talking to patients and families as I'm walking through. And in general, the feedback is great. The physicians and staff, as well as my leadership team, they've all been very open with the challenges and opportunities at both organizations. And I think the thing that has resonated the most with me is how many people have been there their entire career or a large portion of their career, especially at St. Vincent, although Metro West as well. But at St. Vincent, many of the physicians did their residency there, and many of the nurses will talk about working up on the hill. And so when I talk to these people, they've been through the highs and lows that hospitals experience over the years and the changes in communities. And so I've learned a lot about the history of the organizations from them, and that's been really great. So I've tried to learn as much as I can my first couple of months on the job.
And I think they always, whenever I hear CEOs, seasoned CEOs, they always say it's important to listen up front. Don't come in with all these wonderful ideas until you really understand what's going on. So patients may wonder, there's a new person at the helm. Does that mean there's going to be a change in care, a change in service? You've been lucky enough to work on, I read about a big construction project at your last hospital. And that's a question people always have, are they going to expand? It was a big move many years ago. I think they broke ground on the new building in 2000. And then it was owned by Vanguard and then owned by Tenet. So it's had a lot of changes, but you can see it from the highway. It's huge. And then
Yes.
you have, these centers around there. Are you looking at, is there any construction plan? I haven't heard too much because everybody's talking about the Red Sox construction plan, which isn't far from you, but and that can only probably make access better for you. But is there any plan? Are you hearing any other common themes about, we need to expand here, we need to look at this?
So we have a small bed expansion happening right now. We are adding 8 behavioral health beds, which is badly needed in the state and really across the country. Those will be open later on this year. We are also upgrading our electrophysiology lab. So right now, it's a lot of small projects in the hospital, and there's still room for us to expand the beds within the existing footprint of St. Vincent. Where we're actually expanding the footprint more is in the outpatient locations. And we are looking at how we can bring more services to the community so that people don't have to travel as far for their care.
Right, and that's actually something I wanted to talk about because I live out more towards Northborough, and I'm seeing, St. Vincent's has now where they have different physicians rotating in and out, and I know they're opening other locations. I don't have a list of all of them. But is that part of, again, you're seeing much more urgent care go up, and there's been discussion both ways of whether people are going to urgent care and that relieves ERs, and I don't want to get into that discussion, but what do you think is the importance of going into the community? And is that something you saw when you were at other hospitals?
Most hospitals today have an outpatient strategy because it's a lower cost of care, which is good for everyone, and it causes people, especially those with chronic diseases or difficulty traveling, it gives them that care closer to home, and it makes it more convenient. And if your care is more convenient, I like to think you're more likely to actually go to your appointment because it's less of a hassle to get there. So it was a strategy when I was in Texas, it was a strategy when I was in Pennsylvania, and it's a strategy throughout Massachusetts. And so we are actively looking for what sites we have now that we could possibly add services to, as well as where we might want to add other sites.
Now, does that include the Natick Framingham area as well, too?
Yes, it is both. It's a similar strategy at Metro West as for St. Vincent.
Okay. So I know for myself that I'd much rather go. Some of my doctors rotate in and out of the local place, and I don't have to pay to park. And I guess what I hear you saying kind of is the whole argument of, it's an insurance argument, but I personally think it's a good one of preventative medicine. Mm-hmm. Because it's going to end up costing everybody less in the long run, correct? Because if you're practicing good preventative medicine, your insurance costs will be lower. There won't be as many. I'm asking, I guess. This is what I would think. I've heard, what is the point to you, the importance financially to the community, to a consumer's health costs, the hospital's costs, of people really working on preventative medicine?
Primary care and preventive medicine are incredibly important. If you use the emergency department as your primary care, your chances are you're waiting until you have a really serious condition. And the emergency department is one of the most expensive places to receive care. So ideally, people have a primary care physician who follows them, who works on finding out what are the warning signs, what can we do from a medication or a lifestyle change perspective to help you avoid that hospitalization, avoid that procedure. So many of the chronic diseases are lifestyle related. And so if we can have someone who's intervening early, we can certainly help with that. And certainly there's many conditions that are not lifestyle related. We want to intervene quickly on those as well. But the more you can do as early as possible, the better the outcome and the lower the cost.
Yeah. I think, just so listeners understand, I read that you plan to put together, obviously, your own strategic plan for improvements and growth at the 3 facilities. So after you get through listening, when do you go to and it's interesting because I looked at the executive committee list at St. Vincent's, and we're going to get into this whole thing because I will admit it's a big issue for me, and I think for a lot of people listening, female and male, that women are still bumping up against that glass ceiling. And but I noticed too at St. Vincent's, your executive board, you have 3 women out of, 7 or 8 people. So it's great to see someone come in here, but as a female CEO and not a doctor, which is a later question, you have a background in chemical engineering. Why did you decide? Because I think people really want to know a little bit more about you. Why did you decide to go from chemical engineering? I think you went to pharmaceutical, and then jump to this leadership program and get into hospital administration.
So I was in pharmaceutical production management out of undergraduate and spent 4 years in that role and really enjoyed it. And I decided that I wanted to go back to get my MBA, and my goal was to be a manufacturing plant manager. That was my goal. But when I graduated in 2002, 9/11 had just happened. There was a real shift in who was recruiting, and manufacturing in the U.S. was a little challenged at the time. I saw lots of offshoring going on, and I decided that I might need to look in different industries. And at the time, Tenet Healthcare was recruiting for their leadership program. And as I thought about it, there were a lot of similarities between a hospital CEO and a plant site manager. You were responsible for your employee engagement. You were responsible for community involvement, quality of the product or quality of the care, efficiency, everything. It was a great general management opportunity, but more importantly, leading a hospital. Hospitals are something that can never be offshore. They're something that are important to the community. And hospital CEOs are needed in every community across the country. And so as I looked at it, I said, wow, that seems like a great place. It fits with the type of job I want. And as an engineer who liked to make things efficient and knowing that hospitals were notoriously inefficient, I thought it was a great way to utilize that skill and pivot into a new career, into a new industry. And I have enjoyed it since I first made that decision. It's been a really great opportunity, and it enables me to really feel a true sense of making an impact on people's lives every day.
And that's so interesting to see how you bring them together, because from more of a process standpoint, it is true, and the knowledge base is similar. Now, you went to Harvard for your MBA, so you lived in Massachusetts many years ago, and biotech has now become this big thing, and it's very big in the Boston, Worcester, huge growth. Did that surprise you when you came back? What did you think when you came back to the state as far as the state of medicine and medical care and hospitals and what we were doing in Massachusetts from, 16 years later, 17 years later?
So I think Massachusetts has always been at the forefront of a lot of things. Health policy being one, things like mass care where everybody in the state is covered. There has really been a lot of just forward thinking. I think biotech is another place where there's a lot of leading that's going on in Massachusetts. I think education, best public school system in the nation, which is a great find for my husband and I. And it's something that I really knew a lot about. And obviously, since I still get all the alumni publications from Harvard, I'm connected in with what's going on there, what a lot of my classmates are doing, and a lot of my business school classmates still live in Massachusetts. So I have a little bit of an insight into that. And then, of course, everybody knows about the big academic medical centers in Boston that are at the forefront as well. So there's a lot going on in this state, and it's really great to be part of it.
Yeah, I think that's a good answer, too, because Worcester historically has, and everyone says this word, and I don't like using it, but I found it to be true because I adopted the city 25 years ago. I grew up east of here, more towards Metro West, that the city's had an inferiority complex, that we're in the shadow of Boston. You hear it all the time. Now we're coming out of it because of the Red Sox and the restaurants, and it's been a wonderful city in my mind, for 25 years. But then when you think about, this started out when I worked with some biotech companies in a position, Kendall Square in Cambridge was just starting, and Worcester had one research building. And now, that was maybe 15 years ago, it has just skyrocketed and ballooned, and the funding, there's more M&As, but the funding, and Boston Scientific used to be pretty much the only game in town. But you think about what's coming out this way. And if you live in Metro West, this happens in a lot of cases where people, even we were talking to the airport, it's the same thing. Do you decide to go east for your care or west for your care? And I know it has to do with relationships with your physician and where you feel. But when I think about St. V's, and then there's UMass, St. V's we call it, St. Vincent's, in Worcester particularly, in UMass, it's everybody, there's such great facilities that you don't even hear as much of the Boston talk, except, maybe there's some cases somebody might say, well, I'm going to go to Mass General, or I'm going to go to Dana-Farber, and then if they refer me back to Worcester, I'll come back to Worcester. Do you think that's a benefit? I think what you're saying is it's a benefit to have these great institutions in Boston. It's okay to be where we are.
I think it's fantastic to be where we are. As you said, Worcester is an amazing city. it's a manageable city. The traffic is much more manageable than going a little further east, and the offerings of the city are fantastic. But from a healthcare perspective, you can get, I don't know the exact percentage, but I would say at least 95%, if not 98% of anybody's healthcare needs right here in Worcester without going out of the city. There's a few really high complexity, really unique things that you're going to have to go to Boston for. But for the most part, you can get that same great care right here locally, and you can get it a lot more conveniently.
When you look at, and you may not know this off the top of your head, but when you look at the areas of the hospital, and there's so many services that you provide that are fantastic. I know people that particularly personally have gone through oncology, the cancer center, and just had wonderful experience at St. Vincent's. Are there areas of the hospital that you think might be prime for growth when you think about sharing? You know, we've got two fantastic hospitals sharing the same area.
So cardiac surgery is definitely an area and cardiology is an area that is very successful and poised for growth at St. Vincent. Cardiology is also incredibly strong at Metro West. Behavioral health on the Natick campus is fantastic. There's other services at St. Vincent. We just opened a level 2B nursery so we can care for babies down to 32 weeks of gestational age. There's potential to grow in other surgical services. There's a lot of opportunity for growth. And in some cases, it's just recruiting that right specialist or making sure that we have enough specialists to meet the community need. And in some cases, it's buying the latest piece of equipment and making sure that our physicians are trained on that as they would be downtown. So we like people to stay local, and we can provide a lot.
Right. And I guess with the medical school there, no matter who they're tied to, it's a benefit to have a medical school. Now, you came from Penn Medicine, which is tied to the University of Pennsylvania, which is obviously an academic research hospital similar to UMass. And, Tenet being back in the day, Tenet's a for-profit corporation, but I think there's maybe some misconceptions about whether or not that affects care in any way, whether or not you're an academic research institution where you've been, and whether or not you're a for-profit hospital. Frankly, I don't think from a care perspective, I think people want to know, if I'm a patient, does it matter?
If you're a patient, it doesn't matter. Every hospital needs to be financially solvent in order to provide care. If they're not financially solvent, then that's a big problem, because you need to be able to pay your staff, you need to be able to order the right supplies, make sure you're buying new equipment. So everybody, for-profit, not-for-profit, everybody has to have a bottom line. For us, quality of care is so important, and that is something we really prioritize, and we want to make sure that we are providing that good quality of care regardless of what that cost is. So that's something that's incredibly important to us. I think the one benefit of being with a company like Tenet is there's a little more discipline around some things from a financial standpoint, and also we can get to a decision quicker. Sometimes at a large academic medical center, there's a lot of internal politics that go on, and it may take you a while to get to yes. Whereas at St. Vincent and at Metro West, it's much easier for me to actually get to yes when we want to make a change or do something that's going to be impactful for patient care.
That's a great answer. I never even thought of that. That obviously when you're dealing with an academic institution, there's much more minutia that you have to go through. It's not necessarily a bad thing, because like I said, I think we're lucky to have both institutions here. But I think that's a question that's always gone on in people's minds. So I think I think that makes sense. And frankly, I think too, when people look at cost, it's more they're concerned about insurance than their actual physician. I mean, you do see studies all the time for all hospitals around the country about who has the cheaper MRI or who has the cheaper this. But I will say, St. Vincent's, I have to give a shout out to Dr. Michelle Hadley, who you were mentioned cardiology. She's a cardiologist and works with the Heart Association, and I've had her patients in here, and I've worked with the American Heart Association. She was just honored by the hospital, and also the ICUs at Leonard Morris and Framingham Union, which is Metro West, also received high honors within the last 3 months. So something's going right there. I'll tell you that. You have a good ground to start with. So we talked about, being in Harvard, but it's exciting to meet you too, because with all the talk in the news about the glass ceiling issue, I have so much respect for women in any CEO role, whether it's hospital, corporate, non-for-profit. Data shows in many places that many more non-for-profits are run by women. But when you look at a Fortune 500 company, or a large medical institution, not always women. I'm a mom of a 19-year-old daughter, soon to be 20, and you have twin girls. So I don't know how you manage the family thing. We'll have to talk about that off air later. But in a recent article in the Worcester Business Journal, they were talking about how there was a slight increase in women in the boardroom, public and private. Have you ever in your career experienced any comments or feelings of harassment because you're a woman you've been in such a high position in so many locations?
So I wouldn't say that I've experienced harassment, but when I was in Texas, it was definitely unique. Within the parent company of my hospital there, Tenet, it was not odd at all. There were many physician leaders, many female CEOs. However, when I went to meetings with other CEOs of Dallas hospitals, it was largely men, and they were all generally men who were 10, 20 years older than I was. And I just got used to it. And I didn't necessarily think that it was bad or good, it just was. And you just show what you can do from a performance perspective and keep moving forward.
Yeah, I think it's important because, I think I read somewhere that somebody had said when you were leaving a hospital, somebody had made a comment to your husband maybe about, and you might want to explain this better than I, but you had made a comment about how they had said something about, it wasn't a surprise you were leaving, something that happened while you were there. What was that story?
So when I first got to that hospital, we had a very difficult board of trustees. They were actually working with the previous CEO to build a joint venture hospital with our physicians across the lake, and we had to blow up the board. It was a very unique situation.
Which can happen in any company.
Yes, and this particular board member made it clear from the beginning that he didn't like me very much and didn't like what he called my brash Northeastern personality, and didn't.
You're from Delaware, right?
I'm from Delaware, yes, and
Northeastern.
And anyway, that same board member ran into my husband at Starbucks when we were about to move up to Pennsylvania, and he said, Carolyn did a pretty good job for doing man's work. And my husband just kind of stood there with his mouth open, sort of stunned. So I think those interactions sum up some of the people I worked with in that community. But in general, I worked with a lot of wonderful people in Texas, so I don't mean to say that they were all like that particular board member, but that was definitely some of the attitude there. I didn't experience that at all in Pennsylvania, where there are many more women in leadership positions, and certainly haven't experienced that here in Worcester.
Yeah, and hopefully you won't, because there's been articles written too about, when they talked about the board, the article, I have it right here, with women at Fallon, they went from like 32 to 40%. It says Worcester and Sheriff Fallon grew the percentage of women in its leadership from 32 to 40 in the last year. And the executive suite is 5 women. So, I think it's phenomenal. I think it only speaks to, yes, women can be anything they want. They can be doctors, but they can also run the hospital. Okay. So what would you tell college women who are looking to someday be a leader, not necessarily of just a hospital, be in healthcare? Because I think people think that, non-for-profits are often run by women. Maybe doctors, certain kinds of doctors are more likely to be women. I've heard that there's a real need still for primary care physicians, that there just aren't enough people. My friend went to med school about 20 years ago, and she's been in family medicine ever since because they really pushed them hard to not specialize, because the need is so great where she was going in New England for family medicine and primary care. What would you tell women? What would you tell your daughters if they said, you know what, someday I want to run that big building over there?
I would say go for it. Don't be afraid to chase your dreams. I have many chemical engineering classmates from undergrad and many Harvard Business School classmates who are incredibly successful women and have had just phenomenal careers. And they just said, this is what I want to do, and they went for it. And I think the couple of things that I would give anyone, especially women, but really anyone in college, is find out where you can get some leadership experience. Can you be the captain of a club, the leader of a group? How can you use influence, especially if you don't have someone who directly reports to you, but how can you use influence to get things done? And how do you lead people versus manage people? They're two very different things, and you really need to be a leader. And I think one of the key things is learning. If you can take a class on leadership, that's great. I remember at Harvard Business School, we took a class in our first year on leadership, and I wish I had paid more attention because it was the most important class I took at business school. Because everything else, you can always go to a book and check out that accounting or that finance. but figuring out how to lead people and how to get people to work together to reach a common goal, especially when their incentives aren't aligned, that's a real challenge. So that is the most important, is figure out how you can get leadership experience and how you can continue to grow as a leader.
So that, and that would be for any
Yes.
kind type of role, which I think is important. Now, I do want to ask this question, because it's actually been asked to me, and the question is this: I found this article in Forbes about 2 years ago, and frankly, it was funny the way it was written, and it gave both sides of the story. And I'm sure this isn't a question that you're new to, but people wonder, and I know I do, and I look at other hospitals and I say, okay, a lot of them are run by people who aren't doctors. What do you say if somebody says to you, oh, well, I think a hospital needs to be run by a physician? I mean, you've run plenty of hospitals, and plenty of people are not doctors. So what would you say to people that say, well, why isn't this hospital being run by a doctor?
There's plenty of hospitals in the country that are run by doctors, and plenty that are run by nurses and physical therapists and respiratory therapists and finance professionals and chemical engineers with MBAs. So I think it really depends on what your path was to get there and what sort of a leader you are and how well you listen and learn. I've had to learn a lot about medicine since taking this position. When I decided to go into hospital administration, I knew nothing about hospitals. I hadn't been in a hospital from birth until my first week on the job. So it was really a leap of faith for me. And I always like to have at least one, if not a group of physicians who I can go to and say, help me understand this, or what do you think of this, or what's the medical staff's opinion on this, and really want to make sure that they understand, even though we may not always speak exactly the same language, we can come to a common understanding. And I want to know what they need to better do their job, whether it's making sure the OR starts on time every day, making sure they have the right piece of equipment. I want to understand how that impacts and get there. And I can help us get to yes, just the way somebody with a different degree can.
Good answer. So have you had a chance to outline, if you had to pick your top priority for the next 6 months, what it would be?
So that's a difficult question. When I say my top priority, I think
high priority.
I would say the biggest priority is really finalizing our business plan for 2020. I actually fly to Dallas in a couple of weeks to present that. And so that's going to include a wide variety of things, everything from employee engagement, physician satisfaction, patient satisfaction, to where do we put up outpatient centers, how do we grow on the inpatient side. So there's so many different balls to juggle at any given time that it's hard to really pinpoint at this point. But it will be a comprehensive plan once it's all developed, and we'll be putting a bow on it hopefully pretty soon.
And I'm sure we'll be hearing as that plan, when it gets approved, things that are going to be new technologies that are be coming in, maybe new centers that may opening, but obviously the budget has to get to approve first. So we talked about community, you going to the patient, which I think is important. And as we wrap up here, I think we talked about Massachusetts being in a unique situation we have Mass Health for our Medicaid, which was done by folks, and then Governor Romney, it became Romney Cares, and then it became, frankly, I know somebody who worked in putting together the Mass Health Connector and Mass Health, and which is, like I said, our Medicaid program. And they went down to the Center for Medicaid and Medicare in D.C. and went through this whole thing with people that were in the administration prior to Obama and then with Obama. So it's Obamacare, it's Romney Cares, whatever you care. It started in Massachusetts. That's all I know because I was there for some of the beginning of it. So some people say that the Mass Health Connector, the costs aren't going down, in my opinion. What can the healthcare community do? Do you think we need to improve in Massachusetts with access to health care, or is that just an issue everywhere? Do you think we're in a better position, or do you think that it still is an evolving situation?
I think it's evolving, but I do think that the statewide coverage makes it easier for us to hopefully achieve that than some other states. Access to care is really critical, though, and there is definitely a shortage of primary care physicians. And so if you can't get into the primary care physician, then you're going to choose a more expensive care model. I do think telemedicine is a great solution, but it's not nearly as developed as it should be.
So that gives me a hint that you might be looking at that. And I've heard people look at that, too. I mean, a couple of years ago, it was electronic records, and that was, that's come about. And now as a patient, I do like having the portal. I don't know if all seniors who may not be as computer literate love that yet, but I think that's been in my opinion, a very efficient way as a patient. I enjoy having that opportunity to be able to email and know in 48 hours I'm going to get an email back. But yeah, telemedicine is something that I'm glad you brought that up. So lastly, I ask every guest this, and you've answered it in some form, but do you think there are misconceptions or maybe misunderstandings when someone hears that a hospital is owned by a company versus being nonprofit? I mean, as you said, there has to be money there for healthcare. So whether you're for-profit or non-for-profit, it doesn't really matter.
I think in some cases,
as far as access to care.
Sure, access to care, there is no difference. We all care for the same patients. We're all required to do follow the same guidelines when someone comes into the emergency department. We care for people regardless of their ability to pay. So there may be some misconceptions, but if you dig in a little deeper, you'll find out we are much more alike than we are different.
Good point. All right, so you've come to Central Mass. Do you have a favorite restaurant yet? Metro West, Central Mass?
So,
what are the girls like?
So my one twin and I both have celiac disease. So we have to eat gluten-free. And I will tell you, one of our best, most exciting finds in Massachusetts is how great the restaurants pay attention to food allergies. So 110 Grill is fantastic. We really like Burton's and we really like Red Heat Tavern. Those are our three
in Westboro, I haven't been there yet.
Our go-to gluten-free restaurants right now.
But that's interesting. So where you came from wasn't as attentive to gluten-free?
Sometimes you'd have a server who would say, well, rice, that's not gluten-free, right? And I would say, of course, rice is always gluten-free. Whereas the first time we went to 110, the server came up to us and said, if a manager does not deliver your meal and it does not have an allergy stake in it, they have a little stick that says allergy on it, send it back, because that means it's not gluten-free. I mean, they pay such great attention. So we're really thrilled with that.
Well, I'm glad, and we're glad to have you, and I'm pleased that you were able to sit down with me today. Like I said, you're a great role model. I knew this was going to be a great conversation. And I think it's important for moms listening who have girls, and frankly, men too, need to understand there's women in the boardroom, and there's a lot of women who have their eye on the CEO's office. So I look forward to seeing what you have in store for St. Vincent's and for Metro West in the surrounding community. So thank you to my guest, Carolyn Jackson, who was official as of about 10 weeks ago, the CEO of Tenet Healthcare in Massachusetts, CEO of St. Vincent's Hospital in Worcester, and she oversees Metro West Medical Center, which is Leonard Morrison Natick and Framingham Union in Framingham. So thank you.
Thank you very much.
That's a mouthful, and I know you have a ton of work to do. That's Community Conversations. I'm Vicki Green. Have a wonderful day. Day.